I'm Dr. Hunter Champion with Southeastern Cardiology Associates in Columbus, Georgia. We have a large regional-based practice. We know that long-term exposure to high systemic blood pressure significantly increases the risk of stroke, heart attack, and other end organ damage. Hypertension is the #1 killer in the world. Ever since we were pediatric patients, we've been having our blood pressure checked in the same way, in the same manner, using a cuff on the arm. It's very convenient, it's easy to do, it can be done quickly in the doctor's offices. What a lot of people don't realize is, by just taking the blood pressure in the arm, you're not getting all of the information. Really, you've got something here called the central aortic pressure, which is actually what the patient feels. That central aortic pressure is what we want to try to treat, and previously could not treat because the only way we could get that information was by sticking a catheter in the artery and going up to that edge. Now, by using non-invasive technology called SphygmoCor to then assess that central aortic pressure non-invasively. By being able to assess this, we're able to better treat blood pressure. You need no more additional training and no more time than you would need to take a traditional blood pressure measurement using the brachial artery and cuff. The clinical assessment of central aortic pressure and the pressure waveform really does allow us to personalize a patient's medication regimen. It allows us to select the proper medicine for that patient in the treatment of their hypertension. This alone may impact their overall outcome. It really should help us ensure more compliance with patients. We'll have a less of a side effect profile potentially. Putting everything together, the assessment of central aortic pressure and pressure waveform non-invasively may have big impacts with regard to healthcare savings. It's not uncommon to have patients come in saying, goodness, whenever they try to change my blood pressure medicine or add on a new medicine, I have side effects. I get dizzy. I feel fatigued. I feel worse than I should. And by doing a SphygmoCor non-invasive assessment of central aortic pressure and waveform analysis, that we see that they're being overtreated for their blood pressure. Even though they're being treated by guidelines, they are being overtreated such that their central aortic pressure is at a symptomatic level for them. What we find then is, by reducing a patient's medical regimen, or in some cases, by doing something as simple as changing them from a thiazide diuretic to a calcium channel blocker, by having more impact on that arterial stiffness, we find that we're better treating patients with fewer side effects. The proof is when they come back and say, gosh, I feel so much better and my blood pressure is well controlled.